Good day, everyone! I know that you still don't know me, so allow me to introduce myself. I am generically known as MECLIZINE, a respiratory system drug, and joining us today is a younger version of me, who I call M. You're probably wondering what the video will be about. Well, just this morning, M asked me a favor. So M, can you tell them what favor was that?
I've been wanting to know more about myself. Since you are way older than me, I figured you probably know a lot of things I have yet to discover. So I asked if you could tell me things that you have learned over the years about us.
I've got you, Em. And yes, that's the reason why we're here, and we will be filming your learning journey as well. Let's start with the names.
Oh, I know that. My full name is MECLIZINE, but my friends, almost everyone actually, calls me M. I also know my brand names. You can ask for me in your local drugstores as Antivert, Divert, Dramamin 2, Univert, and Vertine.
You're doing good, Em. What about for a chemical name? Any idea?
That I don't know.
It's actually complicated, so I'd understand if you still don't know. We are chemically known as 1,4-chlorophenyl phenylmethyl 4,3-methylphenylmethylpiperazine.
Whoa, is that even a name?
It really is. Now, do you know what drug class are we under?
I remembered it right. We are therapeutically classified as first-generation antihistamine, anticholinergic, and anti-emetic or anti-motion sickness drug.
What a sharp memory you have, Em. Let me also add that we are marked as Category B in FDA's pregnancy category. Animal studies have not demonstrated a risk for the fetus, but since there are no adequate studies among pregnant women, we should be used during pregnancy only if clearly needed.
I'm learning so much with this talk. So glad I get to know myself more. Anyways, sorry for the blubber. Let's just move on to how we work, or basically, our mechanism of action. I don't know much about this, so I'll just list.
Our antihistamine action works by blocking the effects of histamine at the histamine 1 receptor sites, thereby decreasing allergic response. First-generation antihistamines also possesses anticholinergic activity, which works by blocking cholinergic synapses in the vomiting center and reducing the labyrinth excitability and vestibular stimulation, which results in preventing or treatment of nausea, vomiting, and motion sickness.
Oh, now I understand why we are indicated for the relief of symptoms associated with seasonal rhinitis, allergic conjunctivitis, uncomplicated urticaria, and angioedema, as well as for the symptomatic treatment of nausea, vomiting, and dizziness associated with motion sickness, and management of vertigo due to vestibular disturbances.
According to our pharmacokinetics, we are well absorbed orally with an onset of action of about an hour. The time for us to reach peak plasma concentration range from 1 to 2 hours. For our metabolism, according to the findings of in vitro studies, we may undergo aromatic hydroxylation of benzylic oxidation mediated by the hepatic CYP2D.
I have learned that we have plasma elimination half-life of about 5 to 6 hours in humans, with excretion in the feces and urine. We also cross placenta and may enter breast milk.
Did you know that as much as we are helpful to some patients, we may also bring harm to them?
Really? How sad. I didn't know that I'm capable of harming anyone.
It's literally out of our control. That's why it's important to remember who we are contraindicated in order to prevent harming them unintentionally. Take note that we are contraindicated with patients who has known allergy to us and your friend cyclizine, as well as to those patients who has narrow angle glaucoma, cardiac arrhythmias, symptomatic prostatic hypertrophy, bronchial asthma, bladder neck obstruction, postoperative state, and pyloroduodenal obstruction.
Written in my notes that we must be used cautiously with patients who has renal or hepatic impairment, as well as to those women who are pregnant or lactating.
Exactly! I hope our viewers are still all ears and taking notes. What we'll be talking about next is our adverse effects. The most often seen for the central nervous system are drowsiness, confusion, and sedation. For gastrointestinal are dry mouth, anorexia, nausea, vomiting, diarrhea, and constipation. Whereas for gastrourinary, we have urinary frequency and difficulty urination. In cardiovascular, we can cause hypotension, palpitations, and tachycardia. We may also cause skin rashes and urticaria.
Oh, I see, we're almost done. We've arrived to the most important part. I really am eager to know more on how nurses should handle us and the patient before, during, and after drug administration.
Grab your pen and paper and scribble away as I talk. Before drug administration, the nurse should start with assessing the patient for any of the contraindications mentioned. Next, the nurse should conduct a physical assessment which consists of skin, reflex, ophthalmic examination as well as the vital signs of the patient. During drug administration, administer as prescribed by the physician and avoid excessive dosages. If what's available is our tablet form, the nurse should instruct the patients to chew carefully before swallowing. Make sure to guard the patient against fall or trauma since dizziness, sedation, and drowsiness might occur.
I would also like to add, if we are to be used as an anti-motion sickness drug, remember that we work best if taken ahead of time, for prevention. Also, the nurse should make sure to remind the patient to avoid alcohol as this could lead to severe sedation. Educate patient and family members about drugs' effects to the body and manifestations that would need reporting, like difficulty breathing, hallucinations, tremors, loss of coordination, visual disturbances, and irregular heartbeat.
Well said, Em. After drug administration, the nurse should monitor patient response, such as relief of the symptoms of allergic rhinitis, including also monitoring for adverse effects.
Evaluate as well the effectiveness of the teaching plan. See if the patient can name the drug, the right dosage, adverse effects to watch for, specific measures to avoid them, and measures to take to increase the effectiveness of the drug. And lastly, effectiveness of comfort and safety measure and compliance with the regimen should be monitored.
That's all there is to know about SM. I hope you learned something from this talk.
Thanks for this, Miss MECLIZINE. The journey of knowing myself is so empowering. And to our viewers who was with us all the way, I hope you learned something as well.
Bye-bye!